Afternoon and welcome to the Multicultural Media Online Conference. We're hosted by the Multicultural Health Communication Service, Ministry of Health, with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for these sessions. Thank you again for joining us. Today, our focus is on sepsis, and we'll find out all about this potentially very deadly disease. And so we have joining us, and I'm very pleased to have an invite her. We're glad that we've invited her again. We have Dr. Helen Goodwin, Chief Paediatrician of New South Wales Health. Thank you for joining us.
Thanks for having me, Jesusa.
It's almost a year and you're back here again to talk about sepsis.
Doesn't feel like very long at all.
No, it doesn't. And we also have joining with us online is a good friend of the Multicultural Health Communication Service, and he is Associate Professor Stephen Lee. He is a Multicultural Health Lead of the New South Wales Health Pathology in Western Sydney Local Health District. How are you, Dr. Stephen Lee?
I'm fine. How are you?
We're good. Thank you for joining us today and making the time. We're really pleased that you've joined us, and Helen and Stephen are here to answer all your questions about sepsis. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we all meet from today. We pay respects to elders past, present, and emerging, and pay that respects to Aboriginal colleagues and communities. And we also acknowledge the elders and leaders of multicultural communities who may be joining us online as well. So thank you for joining us. We'll do our best to answer your questions. Sepsis is something which is new for a lot of communities, but maybe also something that a lot of people have been thinking about as well. So we'll begin by asking questions to Dr. Helen and Dr. Stephen, but please keep your microphones on mute, type your questions on the chat, and share your thoughts and maybe experiences and questions that you would like to ask Helen and Stephen. So we'll begin with the question. Dr. Helen, welcome back. And the question we touched on sepsis last year, and we're speaking about this again because it is serious and it requires immediate attention. What is sepsis?
Sepsis is when your body has an extreme life-threatening reaction to an infection. So infections that can cause sepsis can come from anywhere in your body. They could be from your chest or your belly, a wound or previous surgery, something like that. And then your body just has an overwhelming reaction to it and becomes very sick and causes dysfunction in the main organs, your heart and your kidneys and things. So if someone has sepsis, they require immediate medical attention. You can't catch sepsis, but you can catch the infection that can cause it. So you're not going to catch it from somebody else, but if they're very sick, then you should think about going, straight to hospital. Yeah.
Is there a time when people are prone to getting sepsis?
Well, sepsis can happen at any time of the year, and sometimes there's outbreaks of things, that can cause sepsis. But particularly at this time of the year, we start to be aware of respiratory illness, particularly flu, that can be a precursor to getting a secondary bacterial infection or becoming really unwell. So we particularly pay attention to it, coming into flu season. And particularly want people to think about getting immunised because that can help prevent overwhelming infection from other things as well.
So it's particularly there's a vaccination for the other diseases, but not necessarily for sepsis?
Correct. Sorry. Yes. You can't be vaccinated against sepsis, but you could be vaccinated against flu, which can make you more prone to getting sepsis. You can be vaccinated against some of the other bacterial infections, and obviously childhood immunisation protects a lot of children from getting sepsis and becoming unwell.
Yeah, well, thank you, Dr. Helen. And the campaign launched this week, which is really timely for the community. Dr. Stephen, are there some people who are more at risk of developing sepsis?
Actually, people at all ages can get sepsis, but some people are more at risk. For example, the very young and the very old. The very young, we are talking about 5 years of age and under, in particular babies under 3 months of age. For the old people, we're talking about elderly people like 65 and above, and also people who are pregnant or have recently given birth within 6 weeks, and people with weakened immune system, and people with chronic illnesses such as diabetes, lung disease, or kidney disease are also at risk of getting at high risk of getting sepsis. And people who have recently been in hospital or had a severe illness, or people who have had sepsis before, and also some specific population like Aboriginal and Torres Strait Islanders, and people who have had sepsis before, they are all at risk of getting more likely to get sepsis.
Dr. Stephen, if someone did have sepsis, how would they be feeling?
They will be feeling very sick very quickly. So the sepsis is something that has to be managed urgently. There's no time for you to wait, and you can tell that the person becomes very sick very quickly, and you must try to get medical assistance as quickly as possible.
What symptoms should we be looking out for? So people, if we know, so that we can share this with our friends or family, especially with young children, which is your specialty.
Yeah, exactly. Look, you don't need to have all the symptoms of being very unwell to have sepsis, but people, as Dr. Lee described that they've felt sicker than they've ever felt in their life. So they just feel really terrible. That in people who are verbal or old enough to tell you that they feel very, very sick, or have unexplained pain that's out of proportion that they can't explain. So, children who are refusing to walk because they're saying they're in so much pain for no obvious reason. But then other things are more specific, like, difficulty with breathing or breathing really fast, new confusion. So particularly in elderly people and younger children, they can become confused, or have a change in behaviour. So small babies might just be not interested in feeding, or being a bit floppy or pale, or a very irritable cry, not knowing, what's going on, and seem to be not themselves. And then some signs of, the organ dysfunction that we talk about is kidney dysfunction. So not weeing, not weeing for a long time, or a new rash, for example. So particularly the dark, splotchy, red, bruised rash that we see in meningococcal sepsis, where you press on and it doesn't go away, and it looks like big bruises coming up everywhere. Sorry, that's a really serious sign. You need to be straight to hospital. But sometimes we also just see children and adults who just look a bit blue and pale and just mottled and not right. That on the skin, that would also be something to look out for.
Wow, it sounds really serious. And it says in statistics show that in Australia, at least 55,000 people develop sepsis each year, and more than 8,000 of them die from sepsis-related complications. Now, some people might find it hard to feel that they're questioning doctors. It's hard to ask the questions. What kind of questions should you be asking your doctor?
Look, I think if you feel worse than you've ever felt in your life, you need to say that to the doctor, and remembering always that we're all part of a team. So even though you feel as though the staff might be very busy, or they're busy with other patients, then just be brave enough to ask, could this be sepsis? And also, if you feel that the person that you're with or yourself is getting sicker quickly, just let people know, my child's getting worse. I really need you to come and see them, because getting worse quickly is one of the signs that we worry about, and people know their children and their family best. So please be brave enough to speak up. The only silly question is the one you didn't ask. That's what you got to keep remembering. Just ask the question. If you need help with language support, ask for an interpreter, or use your phone or something like that, or try and get someone from your family to talk to the staff and say, we're really worried because we think they're getting worse. Could this be sepsis? Just ask the question.
That's what I remember from last year's discussion that we had. Could this be sepsis? Now, healthcare interpreters are available in hospitals across the local health districts across New South Wales. So I guess if you needed one, you just ask your health professional and they can get one for you.
Yeah. And you can go on your phone as well, as you know, for a telephone interpreter service, and get one straight away on the phone as well.
Yes, that's TIS 131450, and also Health Direct if they needed to. If they're at home and they felt really unwell and anyone needed to ask that question, they can call Health Direct.
Yes. If you're so sick that you think you need to go to hospital, then call an ambulance. But if you're not sure, then Health Direct is absolutely the right place to start.
And again, there's TIS line 131450, and ask for the Health Direct line. Now, Dr. Stephen, sepsis sounds really serious, and it is, and I think we should take it to heart how important these messages are. If your child or loved one is very sick, what actions should they take in terms of being at home? Which you just explained, call that doctor. But if we were to relate this to the community, for example, how important is it for us to be, for those listening online, to be able to share these messages to the multicultural communities?
Yes, sepsis is very serious, and people need urgent medical attention. So the first key message is don't wait, and then call 000 to get an ambulance, or go to the hospital emergency department immediately if you think you have any of the serious symptoms of sepsis. Even if you already have seen your doctor, if you or your child is still very sick and getting worse in particular, go back to your doctor or call Health Direct on 1-800-022-222 if you are not sure. And when you reach the hospital, if you need an interpreter, you can always ask for one. And if there is no interpreter around, the hospital can also call the TIS line 131450. But most importantly, it is important for you to ask, could it be sepsis? So that that could get people to think about along that direction.
Dr. Stephen, in the community, for example, from my community, I've never heard of sepsis. So it must be difficult to kind of express this. We know influenza, we know COVID, and we now know RSV, but sepsis is something that not many people know. And how can we explain this easily as a doctor from the community? How can we do this? And how can we direct our communities?
Yeah, you are spot on. I've been working with a number of multicultural communities, and I don't think people in those communities have heard about sepsis, and definitely they won't think about it. That's why I think this sort of campaign is very important to get the message across. And as a matter of fact, during the COVID-19 pandemic, we have identified a major gap in the multicultural community, such that the general knowledge in infection or even sepsis is pretty low. So that's why this year we have founded the National Peak Body in Multicultural Health with the hope of further putting the gap together, closing the gap together.
Dr. Helen, you mentioned earlier that babies and young children are more at risk. Are there specific signs or symptoms to watch out for young children?
Sure. So in small infants, like small babies, not very old, little ones, they don't have to do very much except feed. That's kind of their life goal. So if you have a baby, for example, that's just not interested in feeding, not going to the breast, won't take the bottles, just floppy, lethargic, and just losing interest in things, that would be a very concerning sign in a very small baby. In any age child, if they're, like I said, the new confusion or just change in behaviour that's not right, unexplained pain, breathing difficulty, but they just look sick. They're either really irritable, unable to be consoled, frantically not themselves, or floppy and just losing interest in the world. I mean, we always worry in children in hospital, if we put a needle in them, for example, they don't cry. We like hearing a lusty cry, for example. So if a child comes in, we think, oh, they look a bit sick, and we put a needle in them and they don't cry, then we really think, oh, this is not right. So change in behaviour or just not behaving like they should as a child is a big thing. Children with breathing difficulty often make this grunting noise, kind of noise. That's something to be worried about. And then older children, just again, more likely, it can be a bit harder to pick up in teenagers because they don't, they're big and healthy and they don't kind of look as sick. So if they're very febrile, very hot, or just shaky, or just not themselves, confused, breathing difficulty, things like that. And again, the poor not weeing much, all those things should make you think, oh, this person's really sick. Pay attention, ask the question, could it be sepsis?
So it seems like, could it be sepsis? It seems like, Dr. Stephen, in terms of how I understand sepsis, is that it could potentially be really dangerous. It's life-threatening, isn't it, Dr. Stephen?
That's right. It is very dangerous, and if people have sepsis, it is important to be treated as soon as possible. That's why don't wait and either call 000, get an ambulance, or go directly to the emergency department of hospital, because it is important that treatment is administered in hospital as soon as possible to avoid any long-term damage. And even in hospital, you just feel free to ask the doctor, could it be sepsis? If the doctor said, no, it is not, then that at least you know that it is not. But if it is, at least you can prompt the doctor and the medical staff to think about along that direction.
The question here by Sonam, and the question is sepsis known by any other name?
Blood poison. There's lots of older names for sepsis. So sepsis used to be used for people with a bad infection, but now it's reserved for people with a bad infection that have organ dysfunction. So it's slightly, more specifically used just for those very sick people. But yes, in the olden days, it was blood poisoning, or that's probably the main one. Septicemia is another one that people used to talk about. And again, that's that whole idea that you've got an infection in your blood. But sepsis can be in your whole body, not just in your blood.
Yeah. Dr. Stephen Lee, in terms of, in your role, if you were to explain this to someone, from the community, was there any terms that you would have used for example, in your community?
I think different ethnic communities have obviously different languages have different terms. For example, in the Chinese community, they have a specific term for sepsis or septicemia in the past. Unfortunately, this sort of terms are not well known to people. Even after you mention the term, you said the word, they may not understand, and that's why we have to keep on educating people to understand the importance of sepsis and what the meaning is and what they should do when they suspect that they have sepsis.
Stephen, and if you have any questions, please put them on the chat, or any thoughts or any experiences that you've had with your families or friends or communities. Now, Dr. Helen, there was a friend of mine was saying that their daughter had a serious pain in their mouth, and it was and then there was an infection, and that there was some elements that was coming out, and it was really swollen. And so the doctor said, or the patient, just get to the doctor, get it treated, because it could get to sepsis. Is that an example of how it could be?
Yeah, you could certainly have an initial infection from something, anything. So it could be a face, swollen face infection with a bacterial infection, or a wound infection, or a chest infection, or urinary tract infection as the starter. And you need to get those treated, obviously. But if they're not treated, and then the body has this overwhelming response to the infection, then that's when you go on to develop sepsis. So absolutely, if you've got an infection that's obviously getting worse, you need to get that treated. Particularly bacterial infections need to be treated with antibiotics. Viral infections, some viruses can now be treated with antiviral medication. So COVID can be treated in very high-risk people. And influenza, even now, there is some treatment available for people who are high risk to try and reduce the chances of you becoming very unwell. So there is some treatment. So yes, absolutely. If there's an initial infection, that's clearly something that's treatable, particularly if you're in one of those risk groups, then you should have that treated to try and prevent the onset of sepsis. But obviously, some people, it's not always preventable, because people can get sick very quickly. So if you get sick very quickly and you're very sick, the worst you've ever felt before, just go and see someone. And as Dr. Lee said, even if you've just seen the doctor and they've said, I think you're okay, an hour later you're worse, you go back and you say, I'm worse. Could this be sepsis? You're the only one who knows. Yeah, exactly.
Yeah.
You know how you were before and how you are now, so you can see that deterioration or feel that deterioration. And likewise with your children, if you watch your child getting sicker, don't be reassured that you just saw someone an hour ago, because things can be different. And if you're in hospital and you think my child or my loved one or myself, if you're the patient, is getting worse, then please help the staff and help yourself by asking and saying they're getting worse. Because people are busy and, you know your child best. If you know that your child's getting worse, then we really want to hear from you. Say, things are getting worse. Could this be sepsis? And as Dr. Lee said, if the doctors and nurses say, no, we don't think it's sepsis because of all these reasons, then that's great. Or they explain what's going on, but you absolutely have the right to ask, and we need you to ask. We need you to, because you're there and you know you know that family member better than anybody else.
Yes, that's right. And our colleagues from the Multicultural Health Communication Service, JSCAL, has put in the link to the translated resources on sepsis, and we have translated information for communities. So it is important to raise that awareness to the community and even to the multicultural media to just maybe just kind of say it could be sepsis if you get really sick. Could be sepsis, and making it something that could be like a normal word. Could you? Is that? I mean, it is normal in the community in the medical world.
But it's not well known. You're right. It's not well known the difference between having an infection and being a bit sick, and then sepsis, which is a life-threatening emergency. And it can be very hard for people. How would you know? Unless you feel the worst you've ever felt in your life, you're not going to know necessarily. So that's why we just say, just ask. Could it be this? Especially if you're getting worse. Because, no one can be expected to always know the right answers, including medical staff. So just nag us, ask us again. If you're not sure, just say, could it be sepsis?
Yeah.
And why isn't it? If you're feeling worse than you've ever felt in your life, then ask, well, why isn't it?
And why isn't it sepsis? Then there must be an answer.
Could it be sepsis, and why isn't it? If I feel this bad, what is it? And then, we're paid to look after people and to tell them and to listen to them, and that's our job. So people should feel safe that they can ask.
Thank you. Dr. Stephen Lee, what are the ways to prevent sepsis?
Now, sepsis almost always start with an infection. And so I'm sure after the 3.5 years of the COVID pandemic, all of us have been well trained to avoid to avoid being infected. So basically, what we have to do are more or less similar to what we try to avoid the COVID-19. So we just have to keep personal hygiene, in particular, good hand hygiene with regular hand washing. Not sharing personal items such as razors, toothbrushes, etc. And if you do have a wound, keep the cuts and other wounds clean and covered until they are healed. Keep up to date with recommended vaccinations and taking usual medications. And talk to your doctor regularly if you have a chronic condition such as diabetes, lung disease, or kidney disease. Stay at home if you are sick to protect others. Get immediate medical care from your doctor if you suspect that you have there's an infection. So there are many simple things we can do.
So really, thank you, Dr. Stephen. And these are just really simple things. Don't keep your infections, your wound open. Make sure that you have Band-Aid around, because it is many times you don't have Band-Aid at home.
I think, the main thing is to keep wounds clean and dry. So it doesn't necessarily have to have a Band-Aid on it, but you need to keep an eye on it. Do you know what I mean? Keep an eye on a wound or a cut. And if it becomes red or starts to get discharged or mucky, then it needs good clean. And if the redness swells, spreads, you need to see someone, because that would be a suggestion that you've got a bacterial infection, particularly for people, as Stephen said, with underlying vulnerabilities. So diabetes particularly, but any chronic disease will put you at higher risk of an infection. Or again, if you're a very small baby, you're at higher risk. So if you see skin infections and things like that on very small babies, absolutely you should get them seen.
Yeah. Was there any questions from the community and from those online? Please let us know, because I think this is really an important campaign. I know that this is a second year in a row that we've talked about this, but it is, like you said, there is more. It's more different now. It's not just an infection. It's not just blood disease, but it is an overarching deadly. Could be deadly.
Yes, absolutely. There's a recent study done in Queensland looking at sepsis in children, and shows now that it's the most preventable cause of death in children. So it's significant. That was published only in the last month or so. And I think a lot of people will have seen the media coming out of the Queensland Sepsis campaign at the moment about children who became overwhelmingly sick very quickly and died from sepsis, just to try and remind people that it can be dangerous. So if your child is a bit sick or you're not sure, see your doctor, call Health Direct. They can be referred to virtual kids, where they can be seen by paediatric staff online to see what they look like. But if your child or someone in your family seems to be extremely unwell, call 000 and ask, could it be sepsis?
Dr. Stephen Lee, in your experience in the hospital, are you seeing some cases, or what's your advice as well to communities?
I think the most important message is don't be afraid to ask, could it be sepsis? Because there are stories or there are cases in which the parent failed to ask the question, and then very quickly the child died. So the cost is enormous. Don't be afraid, ask the question, could it be sepsis?
And I think that's right. If it's not sepsis, that's great.
Yeah, exactly.
So
Right.
it's good. But I was just thinking about, if a lot of people may think, like you said with the children, that if they're not afraid of the needle and they're not screaming, then that must be something. That means that they're not.
It usually means they're pretty sick.
They're pretty sick.
Yeah.
But also in terms of another question here. So is sepsis solely caused by infections originating from wounds or open injuries?
No. So sepsis can be caused by any infection. So as we said, sepsis is the body's overwhelming response to an infection. So you can have sepsis from a viral illness. So severe influenza or COVID-19 can cause sepsis. Bacterial infections from any part of the body can lead to sepsis. So urinary tract infection, pneumonia, kidney infections, appendicitis. So there's other things that can cause meningitis. There's other things that can cause sepsis. So not just a wound infection, but that's something that, you can keep an eye on and see.
So from our last session, we learned from Dr. Phil Sutton was the big threes. So COVID, influenza, and RSV. You could get sepsis as well from those.
You could. Generally in children, it's from a secondary bacterial infection. So you could become overwhelmingly sick with a viral illness and lead to organ dysfunction, yes. But more commonly what we would see would be one of those conditions starting being the beginning of the illness, and then a secondary bacterial infection, a strep, pneumonia, or some other kind of overwhelming infection that then leads to sepsis. But yes, both could lead to it.
Thank you. Dr. Stephen, I'm just wondering, in terms of health professionals, should they also be asking the patients and also introducing that in terms of an information session? Is that important for the doctors as well, especially from community doctors, to say, could this be sepsis?
Yes, I think it is very important. Obviously, it is a challenge in multicultural communities. And apart from educating the members of the communities, it is also important to educate the doctors in the multicultural communities, to make them think about, could it be sepsis? This is very important. And talking about sepsis in different culture, I'm sure we have heard about the severe infection that is causing a lot of headache in Japan at the moment because of the strep A infection. And once people get sepsis, for example, according to the Japanese statistics, 1/3 of people die.
Scary.
Mm.
That is a scary statistic. And so it is important for us to be very aware of this and to ask that question. Yeah, so we've run out of time, but as we've mentioned, the launch of the campaign was this week, and we have multicultural campaign that's run, and also we have translated information for you to share with your communities. And again, if the question, if it's so painful and you don't feel well, and it's the worst feeling that you've ever had, the question is, could it be sepsis? Now, in terms of your opinion, Dr. Helen, in terms of raising this awareness within the parents, should this be also introduced in for example, in schools, and letting them know about it?
Like, I think probably the parents are where we need to go. I mean, I think schools are very good at picking up children who are sick at school and contacting families if the children are sick. Obviously, if a child got very sick very quickly, most schools would call an ambulance, and I think that's the appropriate thing to do. They tend to err more on the side of caution. So I think schools are probably pretty good at looking out for our children and making sure they're okay. But in terms of, children getting sicker at home or in the community for over a long period of time, then absolutely the parents, families, and just general understanding in the community can help, so that people feel brave enough to ask. Like you said before, some people are scared to ask, could it be this? Just to be able to say, well, could it be this? And then if it's not that, then that's okay. We say, no, it's fine. We don't think it's that for all these reasons. That's okay. But if you're not sure, just be brave enough to ask. Because as Stephen said, that there have been families who've brought their children to hospital worried that they knew something was wrong and worried that their child was sicker than they'd ever been, and they weren't brave enough to say, hey, this is getting worse really quickly, and then miss the chance. So I think people just have to feel safe that they can ask if they're not sure what's going on. My child's getting worse. So I think more families, and there's other places to go, as you said before. If your child's a bit sick at home, or someone in your family's a bit sick, you can ring Health Direct. If it's a child, they can put you through to Virtual Kids, where you can be seen by a nurse online, who will help you decide, is this something that I can stay at home for? Can I see my GP tomorrow? Or do I need an ambulance? So if you're not sure, there is other ways to do it. And as Stephen said before, if you've seen someone, and they've said, I think you're okay, but then, a few hours later, you're much, much worse, just be brave enough and say, it's okay to come back. That's our job.
Thank you so much, Goodwin, for being here today. And Dr. Stephen Lee, any last words?
Yes, we have to encourage people to ask the question, could it be sepsis? And also encourage doctors to think about the question, could it be sepsis?
That's the sepsis pathway. If you're not sure, follow the pathway.
Thank you very much for being our special guest, Dr. Stephen Lee and Dr. Helen Goodwin. Thank you so much for being with us, and thank you for joining us this afternoon. We'll be back in another fortnight. The recording of this session will be available on the Multicultural Health Communication Service website and on social media. An email will be sent out to your communities. Please share this, put this out on your website as well, this recording, so that it could raise that awareness of, could it be sepsis? Have a good afternoon. We'll see you again next time.